Ulcers are a common health concern that affects millions of people worldwide. Imagine a sore, but instead of being on your skin, it's on the delicate lining of your stomach or intestines. That's what an ulcer is, an open sore in the digestive tract. These sores can cause a great deal of discomfort and pain. Understanding ulcers is the first step towards prevention and treatment. There are different types of ulcers, each affecting a specific area of your digestive system. Gastric ulcers occur in the stomach, while duodenal ulcers, a common type of peptic ulcer, develop in the duodenum, the first part of the small intestine. Peptic ulcers, a broader category, can affect both the stomach lining and duodenum. Lastly, intestinal ulcers, as the name suggests, appear in the intestines. Each type of ulcer presents unique challenges due to the varying environments and functions of these digestive organs. How do you know if you have an ulcer? While the location of the ulcer can influence the specific symptoms, there are some common warning signs. A burning pain in the abdomen, often between the breastbone and navel, is a hallmark symptom. This pain may worsen on an empty stomach or at night. Other symptoms include nausea, vomiting, bloating, and a feeling of fullness even after eating a small meal. If you experience any of these symptoms, it's crucial to consult a healthcare professional for a proper diagnosis. Diagnosing ulcers involves a combination of medical history, review physical examination, and specific tests. Your doctor will ask about your symptoms, medical history, and lifestyle habits. An upper endoscopy is often the gold standard for diagnosis. This procedure involves inserting a thin, flexible tube with a camera attached into your esophagus, stomach, and duodenum, allowing the doctor to visualize the lining of these organs and identify any ulcers. Biopsy samples may be taken during the endoscopy to check for Helicobacter pylori infection, a common culprit behind ulcers. Section 5. The bacterial connection, Helicobacter pylori and ulcers. Helicobacter pylori, or H. pylori, is a bacterium that thrives in the acidic environment of the stomach. While many people carry H. pylori without any issues, in some individuals, this bacterium can weaken the protective lining of the stomach and duodenum, making them vulnerable to ulcer formation. Hyperacidity, a condition where the stomach produces excess acid, can further exacerbate the problem by irritating the already compromised lining. The interplay between H. pylori, hyperacidity, and a weakened mucosal lining creates a perfect storm for ulcer development. Section 6. Healing through diet, a sample meal plan. While diet alone cannot cure ulcers, certain foods can help manage symptoms and promote healing. A bland diet, low in acidic and spicy foods, is often recommended. Here's a sample meal plan to give you an idea. For breakfast, you can have oatmeal with almond milk and berries. For lunch, a grilled chicken salad with olive oil and vinegar dressing. And for dinner, baked salmon with steamed vegetables. Remember to stay hydrated by sipping on water throughout the day. Avoid coffee, alcohol, and carbonated drinks as they can irritate the stomach. Section 7. Medical arsenal, medications for ulcers. Medications play a crucial role in treating ulcers, particularly those caused by H. pylori. Proton pump inhibitors, or PPIs, are a class of drugs that effectively reduce stomach acid production, allowing the ulcer to heal. Antibiotics are prescribed to eradicate H. pylori infection. Your doctor will determine the appropriate medication and dosage based on the type of ulcer, its severity, and your overall health. Section 8. The surgical option. When is it necessary? Surgery for ulcers is rare and usually reserved for complicated cases that don't respond to medication or those causing life-threatening complications. For instance, surgery may be necessary if an ulcer perforates the stomach or duodenum, leading to internal bleeding or infection. Surgical procedures aim to stop bleeding, repair the perforation, or remove the affected portion of the stomach or duodenum. As we navigate the journey of understanding and managing gastric ulcers, it's essential to explore the role of prebiotics and probiotics. These powerful allies in our gut health can play a significant role in healing and preventing ulcers. Prebiotics are non-digestible fibers that serve as food for beneficial bacteria in your gut. They help maintain a healthy gut environment, which is crucial for overall digestive health. Common sources of prebiotics include foods like garlic, onions, bananas, and whole grains. By nourishing the good bacteria, prebiotics can help reduce inflammation and support the healing process of gastric ulcers. Probiotics, on the other hand, are live beneficial bacteria that can be found in fermented foods like yogurt, kefir, sauerkraut, and kimchi, or taken as dietary supplements. These good bacteria help balance the gut microbiome, inhibit the growth of harmful bacteria, and enhance the gut's protective barriers. Studies have shown that certain strains of probiotics can aid in the eradication of Helicobacter pylori, a common culprit behind gastric ulcers. Integrating prebiotics and probiotics into your diet can offer numerous benefits, including improved digestion, enhanced immune function, and a stronger gut lining. This, in turn, can help in managing and preventing the recurrence of gastric ulcers. Remember, while dietary changes can be beneficial, they should complement, not replace, the treatment plan prescribed by your healthcare provider. Always consult with a medical professional before making significant changes to your diet or starting new supplements. By understanding and leveraging the power of prebiotics and probiotics, you can take a proactive step towards better gut health and a more effective path to healing. Section 9. Seeking expert care, your path to healing. Ulcers are treatable conditions, and early detection significantly improves outcomes. If you suspect you have an ulcer, don't delay seeking medical attention. Your doctor will conduct the necessary tests, make an accurate diagnosis, and recommend the most effective treatment plan for your specific needs. Remember, self-treating can be dangerous. Trust your health to a qualified healthcare professional for the best possible care.